Everyone, welcome once again to our December HRSN Partner Work Session meeting. We're really excited to have you all here. My name is Zuli Rosales. I use she, her, ella pronouns, and I'm the Senior Community Engagement Analyst on the Community Engagement team with Jessica Diaz. And I'll be hosting for today, giving her a little bit of a break. We're just really grateful and thankful that you're all here. Like I mentioned a little bit ago, please introduce yourselves in the chat if you feel comfortable. Let us know who you are, where you're joining us from. And if you are here, that means you're in the right place. And I'll have Trevor jump over to our next slide. We're just going to go over a little bit of housekeeping. Just some tips with Zoom. Just remember to use the chat function to submit your questions. And we're going to work really hard to be as interactive and as responsive as we can. There will be pauses throughout the presentation where we'll be able to read the questions from the chat. But if you do prefer to ask your question verbally, please raise your hand and we'll call out your name. And apologies beforehand. I mispronounce your name when I call for you, but if you let me know how to pronounce it, I will try my hardest. Also, just a gentle reminder, this webinar is being recorded and it's going to be shared following the session once we have it up. I hope you'll have noticed that we're trying to include all the recorded sessions in our invitations that we have been sending you all, as well as the slide decks from the previous sessions. We also have live captioning available. So if you go to the closed captioning button, which is located at the bottom of the screen, you click on that, you'll be able to see the closed captioning in English. And then we do also have a link for the Spanish closed captioning. And I will drop that in the chat if you need that. And we are having a little bit of technical difficulties with our interpretation channel today, so we won't be able to offer that. But we do have the Spanish subtitles available. And if you hit that link, it'll send you to a website where you will see the closed captioning. Just make sure at the very top there's a menu and you can select the language, switch from English to Spanish, and then you'll be able to access the Spanish closed captioning on that end. Okay, we'll go on to the next slide. Just a little recap for today's agenda. We're going to share some updates on climate benefits. Now we shared a communication with you all, so we're going to touch a little bit on that. And then really we're going to spend the majority of the time discussing the provider qualifications and eligibility. And this is to build upon a previous presentation we had. And so we're going to go into a little bit deeper dive on this, share some updates. We have Lisa here from our leadership team who will be presenting on this. And we have her for questions and answers. So please, as another gentle reminder, ask your questions, make your comments as she's sharing things. If you agree with a comment or a question that has been said by one person in the group, please either react to it in the chat or put your suggestions, or if you agree with that, in the chat so we can categorize all of that and share that feedback with our leadership to let them know that it is more than one person that feels this way about whatever comment or question is being asked. We really want to elevate your voice and make sure that we are accurately taking all of the feedback that you all are giving us that we're really grateful for. And with that said, we'll jump over to the next slide on climate benefit updates, and I'll pass it over to Lisa.
Great, thank you, Zuli. Lisa Croyce, I'm the 1115 Senior Waiver Advisor. I use she, her pronouns. And we are going to pause throughout today's session. Again, just thank you all for attending. We really are looking for feedback, so really appreciate your time and engagement. The first update that Sully mentioned is just want to ensure that everyone is aware we have changed the implementation timeline for the climate-related benefits. They will begin March of 2024. Not January of 2024, as we previously talked with you all about. Part of this has been the result of needing some approval and further discussions with CMS. So we were not able to expand it in the way that we had hoped. And so we just need to continue to work with CMS to get that implemented. So our next steps are working to kind of shift to ensure that we can deliver these resources in March. And we will continue to modify the contracts with CCOs so that we can deliver those services in March, and also to the fee-for-service population as well. So next slide. Here are some resources in terms of follow-up for members and additional information that you all may want to access. And I believe this slide deck has been shared with everyone, so I want to make sure that these resources are available. And if there are any questions that you all want to put in the chat, I'm happy to answer them before we move on to the main topic area. Okay, we'll go ahead and move on. So we want to talk about HRSN services and HRSN service provider qualifications and eligibility. Just a quick reminder, many of you are aware when we say health-related social needs, what we mean by that, but I want to make sure before we dive into this topic area that we're all on the same page. That really refers to social and economic needs that impact an individual's ability to maintain their health and well-being. So some examples are affordable housing, utilities, access to diverse, healthy foods, and support accessing benefit programs. The HRSN services that we're implementing are related to housing supports, nutrition supports, climate-related supports that I just mentioned, and outreach and engagement related to those supports. So we'll go ahead and go to the next slide. And then again, this is just a reminder, we have the authority for about 119 million in what we call community capacity building funds. CMS refers to these as infrastructure funds. These funds are solely dedicated to supporting HRSN service providers, which we're going to talk about in more detail on the next slides. But these are really to support service providers engaging in the Medicaid system, some of them for the first time. So in the appendix of these slides, there's much more detail on the community capacity building funds, but happy to answer questions related to the supports as we get into the requirements. Again, there's 904 million available for the HRSN services themselves to eligible members. And once again, those are in housing, nutrition, and climate and related outreach engagement to support those benefits. So we'll go ahead and move to the next. So I want to move through these fairly slowly and intentionally so that we can really discuss and receive your feedback on these requirements. The goal the goal for these really is to ensure members receive high quality, trauma-informed, culturally and linguistically appropriate HRSN services in a timely way. So that is what these requirements are aiming to achieve. Many of the HRSN services are to be delivered through community partners that have expertise in delivering these services. They're trusted by the communities they serve, and they contract with one or more CCOs to participate in this program. So OHA is requiring CCOs to ensure their networks of HRSN providers meet the following standards. And I want to pause here because we are actually requiring this of CCOs as well as our fee-for-service providers. So this should really be our HRSN providers. So we'll correct that in the future. The provider qualifications, again, are developed to ensure members received high-quality, trauma-informed, and culturally and linguistically appropriate services. And we're going to move through what those qualifications are specifically in the next slides. The readiness assessment is to inform OHA on the gaps in the delivery, the service delivery, and the needed supports to ensure that HRSN providers are receiving the necessary resources to support members and to start participating in this program. Just going to check the chat real quick before we. Yeah, so great question. Looking in the chat, I think the question, it says, can you remind me over what time period these funds are meant to cover? All of the funds related to the waiver are within the waiver period, which is, we were approved in 2023 to 2027, basically. The services funds that I noted are on the implementation timeline. So those will occur as services are available. So we have a timeline related to that in the appendix as well. The capacity building funds will be available in 2024 to support CBOs. And those again are in the appendix for reference. Can we go ahead and go to the next slide? So HRSN provider qualifications, experience and expertise requirements are what we're going to discuss now, and welcome feedback on these. So we are requiring accessibility, including having hours and staff necessary to be available to HRSN participants, that they demonstrate the ability and or experience with support of at least one priority population. We've got that defined in the appendix. But we can certainly pull that up if there are questions. We want HRSN providers to show they have qualified service delivery staff. They follow all applicable federal and state laws. For example, laws related to ensuring access for individuals with limited English proficiency. That they provide trauma-informed, culturally and linguistically appropriate delivery of services. That they demonstrate responsible financial practices. And there are some examples of how that may be demonstrated. Let's go ahead and go to the next slide. So support for community partners participating in the HRSN program. We understand that some community partners and providers may be participating in the healthcare system or engaging in Medicaid for the first time. So to meet these qualifications and readiness assessment standards, we recognize that they may need additional training, technical assistance, and financial support. The standards that we're talking about are not expected on January 1 of 2024. And OHA is committed to promoting HRSN participation among smaller organizations that may have fewer resources but can provide critical HRSN services to priority populations. Go ahead, next slide. Climate provider qualifications. So specific to climate, they must be able to appropriately deliver climate supports. They must be able to install climate devices in a member's home or coordinate with a vendor for installation in a timely manner when needed. So for climate, there is an allowance for a vendor. And so that is a vendor could provide the climate device, but not necessarily install. And so that is appropriate, related specifically to climate supports. So next slide. Housing provider qualifications. They must understand the standards and procedures of housing and support services available through the 1115 waiver for members to receive and or maintain stable housing. They must maintain credentials, licensure, or trainings needed to provide specific services. And they must meet members' needs for housing services or be able to connect members to a service provider or a vendor. Next slide. So nutrition provider qualifications, they must follow all federal, state, and local laws on food safety standards. They must maintain appropriate licensures, trainings, or certification based on nutrition industry standards to provide specific services. So we've got some examples of what that may entail. They must meet the needs of members' personal and cultural dietary preferences. They must be able to provide services on a one-time, daily, weekly, or monthly basis, depending on the service frequency or member preference. And they need to provide or coordinate the services that are provided through a prepared card or voucher. Next slide. Outreach and engagement provider qualifications. So we do have more detail again in the appendix, and happy to pull that forward. But for outreach and engagement, they must have experience and capacity to carry out the responsibilities outlined in our definition of outreach and engagement services. They must complete annual training on cultural specificity and responsiveness, community outreach and engagement, and they must sorry, there looks like there's a typo here. They must be eligible. They must be knowledgeable and of the eligibility and enrollment policies for the HRSN program. So those are part of the trainings. It looks like we just need to fix that slide a little bit. They must be able to communicate complex information in an understandable, trauma-informed, linguistically responsive, and culturally appropriate ways to members, and they must maintain sensitive information and ensure confidential information is managed appropriately. Next slide. Can you go to the next slide? I just want to make sure that I feel like we've gone out of, okay, here we go. So let's go to the previous slide. So in terms of readiness assessment, HRSN providers must meet the following requirements to ensure that they're ready to deliver services. So they must demonstrate readiness to fulfill closed loop referral processes and to render services. They need to attest to compliance with all reporting and oversight requirements established by OA and or the CCO, and they must attest to compliance with state laws relating to privacy and security. Becoming a rendering only provider in MMIS is another part of the readiness assessment. Let's move to the next slide and talk about MMIS a little bit. So MMIS registration and enrollment, this is the topic we've heard quite a lot of questions. We received a lot of questions. We've heard a lot of feedback about this. So I want to make sure we pause here for any questions. HRSN providers will need to be a Medicaid enrolled registered provider through the Medicaid Management Information System. So that's the MMIS system. They'll need to be enrolled in MMIS as a rendering service provider. Enrollment in MMIS will not allow the HRSN provider to bill OHA or see claims submitted on their behalf. The MMIS enrollment allows OHA to perform quality checks on HRSN provider eligibility and standings. And so the MMIS requirement is really a Medicaid requirement to receive payment for these types of services through this program.
Lisa, we do have one question in the chat from James. How is a vendor paid? Is it reimbursement? For example, need to contact a vendor to install an AC unit?
It is reimbursement. And so a provider who's contracted with the CCO will be paid by the CCO. And then for a fee for service member, we have a third party contractor. Now I'm trying to check myself. Actually, I need to confirm. I wonder if there's anyone on here that can confirm for me whether it's the TPC or OHA who will pay the fee-for-service provider.
Hi, Lisa. This is Mary Durant. Can you hear me?
Yes.
Okay, so it'll be OHA reimbursing directly.
Okay, thank you.
You're welcome.
We have another question in the chat. What exactly will we be doing in MMIS?
I'm not sure I understand the question, but maybe I can provide a little detail about the MMIS. If you want to go back to that MMIS page. Yeah. So for the system, it's registering as a service provider through the required Medicaid system. And Mary, if you want to add anything, I'm certainly welcome more details.
Yeah, I think I can help a bit. So as a provider, you will register with OHA. Then when it comes time to submit your invoices, you're going to be sending those invoices to our third-party contractor. That contractor is going to send them as claims on your behalf into the MMIS, which is where they're going to process. So what you may want to do in MMIS is look at the claim status that are sent on your behalf, or then look at the payments that are made to you if you have any reason to research them. So there's a few things that you might do in MMIS, but in terms of what you do with your invoice, you're going to be sending the invoice on the fee-for-service side to our third-party contractor.
And on the CCO side, and Mary, you please correct me if this isn't accurate, the CCO will help facilitate the MMIS registration, and the provider would be paid by the CCO.
That's correct. If you are working with a CCO and not working on fee-for-service, then the CCO will work with you on everything about becoming a provider. And then they take care of that with OHA on your behalf. They would work with you and then they would work with us. So the only time that if you work with a CCO, you would need to do that is if you are also doing fee-for-service. If you're doing both, then you'll need to enroll/register yourself into MMIS.
And I do see Misha has had her hand up. Do you want to ask your question?
Hi, yes, thank you. And I appreciate the clarification around the MMIS because I had those same questions. So I'm trying to get clear on this. So the discussion around the reimbursement and claims that would be happening through the third party or directly through the CCO, I'm imagining those as the services for eligible individuals. That's a reimbursement model. As far as the capacity building funds, how are those funds? Are those also reimbursement model, or how are those going to be distributed?
Yeah, that's a great question. So we are working with the CCOs on a grant program. And so those capacity building funds are awarded as grants. I feel like I've said this a lot today, but happy to kind of go into more detail. We've just spoken to many of you about the capacity building funds previously, so I won't go through the whole process, but happy to answer questions. They will be managing a grant program. There are specified by CMS. There are 4 large categories of allowable uses of those funds. And so they'll be aligning with what CMS has authorized the funds to be used for to make awards. And so in January of 2024, so very soon, we will begin kind of an outreach and education program to providers, really like you all, creating awareness that these resources are available and specifically what they can be used for. We'll have period in, let's see, March and April, where that's where CBOs can apply for these funds. And again, a standardized template is being used for that application process. We've really been working to create a low barrier process. And those awards can be made for multiple years. There'll be guidance included around kind of what resources you really want to ask for and able to support your ability to provide these services. So they'll be available beginning mid of 2024, but the process for getting those out will start in January of 2024. Is that helpful?
Thank you. That's really helpful. I appreciate that.
And we've got another question in the chat. I currently bill an MMIS for OMMP clients. I didn't know if it would be the same.
Lisa, do you want me to take that one?
Mary, I'm so glad you're here. It's so nice to have a real
Absolutely.
expert.
It will actually not be the same. It's great that you already know MMIS, so you'll have that post-process research process. You'll have a leg up on that. But in terms of submitting your services, you're going to be doing that to our third-party contractor, who's going to match it up with the authorization and then send it in as a claim on your behalf. So you won't be direct submitting your claim into MMIS, but we're going to definitely do a lot of outreach and work with you so that you'll know how to submit those invoices or claims over to our third-party contractor, how they're going to do their part on your behalf, and then what functionality you'll have in MMIS to check it along the way and receive out those payments.
Thank you, Mary. And another question from the chat. For the nutrition provider part, is a waiver something that could be used by a food bank?
I'm sorry, can you say that again? Oh, here, I think I see it. For the nutrition provider part, is the waiver something that could be used by a food bank? Is that the question?
Yes. Maybe Marcy, do you want to jump on and provide more clarification?
Yeah, I'm sorry. This is my first time on one of these, so I'm really playing catch up. I was just wondering. I guess I'm unsure that the slide confused me a little bit when it talks about services provided through a prepaid card or voucher. Talks about SNAP, nutrition and wellness educators, but I was just wondering, because we primarily run food through pantries, if that is something the waiver would help cover. And again, I'm playing big time catch up, so it may be too big of a question for here.
I think it's a complicated answer. It's possible, but it really it depends on kind of the way that the food bank is set up. You know, if the food bank is providing free food, then that would not work for this waiver. So one thing that's really important about the authorities we received is that we do not supplant other programs. So we want to complement, we want to fill in gaps, but we do not want to replace other programs in place. Does that help?
It does help. So I just have a quick follow-up question. So if there was like a particular program we were trying to support that we did have to pay for, maybe it could do something like providing senior boxes to seniors, or providing culturally appropriate foods to some of our farm worker organizations, that kind of thing.
Yep. So I'll kind of back out of this a little bit. I think you're thinking about funds going to an organization. And so with this program, it is about a member who qualifies. So they need to be an OHP member, and they would need to, there's eligibility categories, and then they would, yeah. And so it's very confusing, I admit, because we're talking about these capacity building funds that support organizations to be HRSN service providers. And so there are grant awards to go directly to organizations, but they are organizations that are going to need to serve Medicaid members. So
Okay.
it's a little different than providing these funds to an organization to support members. It's really tied as a Medicaid benefit to a member's eligibility.
Okay. Okay, that's very helpful. Thank you.
Yep.
Just want to make sure that the comments on the chat and questions have all been answered.
Yeah, I'm looking at Laura's question about the food bank, and I want to make sure that it's clear with the response I just provided that it could not just go to an organization. It does need to be tied to a member and is about members' eligibility. Oh, great. Sorry, I'm playing catch up in the chat.
And we have a hand up. Arlette, did I say that right?
Yeah, this is Arlette Upshaw from Coos Elderly Services. This might be just an obvious question, but I thought I would just throw it out there anyway. With the grant, that grant amount that is awarded, that is not money that will be provided up front. Instead, it would be money that would be used as part of the reimbursement. So if there's $100,000 grant and we submit a reimbursement of 10,000, that means that 10,000 will be deducted from the 100,000. Is that how that's going to work?
No, this is a great question. I granted this is really, it gets confusing quickly. The community capacity building funds is a separate pot of money, and those funds are awarded really for support of providers. So it's 4 different categories. Technology is one category, training. Oh my gosh, I don't have these memorized. I'm trying to think of what the other 2 are, but they are broad categories that support providers' ability to engage with the Medicaid system and to serve the eligible members with these HRSN supports. So completely different bundle of funds. If an organization requests $200,000 to support their, IT for this work, then they would receive $200,000 for the specified activities, and that would be their funds to use for that. Separately, when they begin to provide services, they'll be reimbursed for the services that they provide.
So for community engagement, how are those funds going to be allocated?
Well, that's a good question. That's a really good question. Community engagement is a reimbursable service. The capacity funds, list one of the allowable expenses as community engagement, but that is engaging kind of with the community. It's not connecting them to services. I have to look at the definition to make sure that we're really being clear on the differences in those 2, but one is really about education and the other is about connecting to services.
All right, thank you.
Would you like us to jump into the slides from the appendix?
Sure. Is that in the appendix? That would be great.
Yeah, it's number 33, the last slide.
So these are HRSN services. So this would be a reimbursable service. So this is the part of the Medicaid benefit. Can we go up to the community capacity building funds allowable expenses slides? There's 4 big buckets, and I did not do a good job of going through those. Those are conditions. Sorry, can we go back further?
26.
Yep, these are the 4 areas. So for instance, this outreach and education is about launching a learning collaborative. So it's really from an organizational level, it's not an individual level support.
We have a question from Nick in the chat. So for something like rent assistance, we could get capacity building funds to support staffing and tech needs to supply rent assistance to Medicaid members.
Yes, yes. So if you're going to be an organization that's going to provide the services, the benefit to OHP members for rent assistance, and you need new technology to help support your organization doing that, there is staffing support, training, recruiting. There's limited resources available to actually cover staff salaries. I think that's 18 months. So yes, that's exactly what the community capacity building funds could be used for. Thanks, Suzanne, for putting those in the chat. So the next question that I'm seeing is reimbursable, meaning we pay out of our pockets and then submit for reimbursement, correct? So for services, for providing a Medicaid service, it is a reimbursed service. And I do want to make sure that we really focus on provider qualifications. So maybe we can go back up to those slides. Yeah, the next question that I'm seeing, and please help me if I've missed any, says, will contracts for rent assistance provide any requirement to coordinate with housing delivery system like community action agencies or continuous of care? We are in development of requirements. We have not made final decisions about those requirements. Next question I see is there any mechanism to allow our provider to serve multiple or all OHP covered individuals versus only those from one CCO? Yes, you can certainly serve multiples. You can serve members from multiple CCOs as well as fee for service. So I guess I want to draw the link again to the community capacity building funds. So you would be able to request funding for doing that. And you'd want to indicate the multiple CCOs and or fee for service population that you anticipate serving.
Just checking in, Nick, did we answer? I know you put in a couple of comments and questions. Want to make sure that we answered them.
Yeah, just wanted to double check. So what's the process for getting approved to like provide something like rent assistance to Medicaid members? Is that through the CCO? Is that, I can't remember what we talked about as far as like how you get approved to become that group, part of that group.
Yes, That's a really great question. We are going to come back with what we call the provider journey, which walks through all providers, what they would need to do exactly that. And Trevor, can I ask you to go to the requirements slide, the provider requirements slide, so that we can ensure, you know, we get all feedback on those requirements. I think it's like the third slide in.
Sure.
Thank you. So just in follow up to that question, so, you know, we want to really walk through providers, like here's what it means to register with MMIS. Here's what it means. Here's the process for being HIPAA compliant. We've got a form for that. So all of the things that a provider will need to do, we're still developing them. And so once we can finalize them here in the next few weeks, we want to bring that back and really walk you all through them, and again, get your feedback. I'm curious if there are any, you know, 1 through 6 on here, if any of these feel like challenges or raise any concerns, or are pretty much kind of standard operating procedures for you all. If there's any feedback on these.
So this is Erlat again. Can you give an example of, for number 3, how to show that they have qualified service delivery staff?
Yeah, so I think it depends on what service the organization is going to provide. And I think there's a lot of flexibility in how they would show that, but I think it's really detailing out what your organization intends to do and how they would do that. So, you know, if you're going to provide rental assistance or housing support, you would want to be able to detail out your staff that is going to be able to do that. And Mandy is helping me out with a suggestion of an org chart. So like an organizational org chart that details out the roles and responsibilities within the organization.
So would that mean that if they would have to be existing, or would it be something that would be created once approved as a provider?
Yeah, that's an interesting question. So I think that would be up to the discretion of a CCO. I think if it is, so again, I feel a little bit like we're mixing kind of the capacity building funds process. So that is the process that is a grant award process that will help your organization really get to the place that they need to provide these services. And in that process, you could certainly project the staff that you want to hire, that you want to train, what your organization would look like with the funds that you're requesting. And so that's, you know, completely appropriate to kind of map out the future state. I think it's more challenging if you're proposing to be a service provider. You know, you would also need to show, you know, how you were going to provide those services, right? Does that make sense? So if we're talking about the capacity building funds, you show the pathway by which you're going to staff your organization. If it is a contract to provide the services, I think you would need to show that, and it would probably need to be a current state.
All right, yeah, because that word qualified kind of, you know, takes on a different definition, because if you're going to want to try to provide housing support, does that mean that you have an employee that used to work for the housing department? Or, you know, that's how I interpreted the word qualified.
Yeah, and so if we go talking kind of this cross-sectional across the domains gets a little less clear. If we want to kind of go down to nutrition and housing, nutrition specifically, there are qualifications for providers providing nutrition services that are very unique to nutrition domain. So that's where we've used a broader term like qualified. When you get into the domain, the service provider specific domain, there'll be more tailored requirements. Is that helpful? We can go to the housing. I think, did you say you were specifically interested in housing? Trevor,
No,
would you?
no,
Yeah.
I was just giving that example.
Okay. Yeah.
All right, thank you.
I'm just looking in the chat to make sure we answer all these questions.
We have a question from Lindsay. Just a concern for our rural areas having local resources who would be within capacity to contract.
Yeah, and that's something that we've heard, really looking for specifics in how we can use the capacity building funds to support them to be ready. This is certainly something that we've been talking to CCOs about. We've heard, the concern about the lack of providers in rural areas. So, appreciate any feedback, specific resources to support that. We've got some, one-time financial resources to support them. So we are hoping that we can be strategically using those resources to build that up.
Another question in the chat. Do you anticipate using CIE to make referrals and run billing/invoicing? If not CIE, how else might we expect to get referrals? And will there be coaching around the HIPAA compliance piece of this?
Yeah, great questions. So for CIE is certainly encouraged, and it is an allowable expense for the community capacity building funds. So that if that is something your organization is interested in further developing, that would be a great use of those funds. It's not required. There are processes that you can develop with the CCO or TPC that you contract with. For the HIPAA compliance, there is a form and a process that's being developed. I think long-term, so that's the near term is using that form and process. Longer term would be gaining HIPAA compliance. And that again is something that we'll bring back as a part of that provider journey so that we can really walk you through what that looks like. Did I answer all of those questions, Sully?
We have a couple more. We have another comment. I would strongly advocate for a requirement for entities contracting with housing to prove coordination and collaboration with existing pathways for rental assistance/homelessness prevention, such as community action agencies and continuums of care. Not doing so risks creating parallel systems.
Great, thank you for that feedback, really appreciate it.
And another question, what is the anticipated timeline for capacity building funds versus becoming an HRSN provider? Are we doing one before the other or at the same time?
Yeah, that's a great question. The capacity building funds, you're not required to seek an award or grant through those funds to be an HRSN provider. There are some service providers that may be ready and they can seek to contract to be an HRSN service provider as soon as those services are available. So for climate, again, that's in March. They're not tied to one another. There are organizations we know that are going to need the support. And so if they need a year of support prior to becoming an HRSN service provider, that is completely appropriate. They don't need to come online when the services come online. Really, you can just map that out in your request for funds, and you know, contract to be a service provider when it is, you know, is best for your organization and your organization's readiness.
Thank you, Lisa. And I just want to clarify a question in the chat from Laura. Could you share the information where we can get registered for the following course? I just want to make sure we answered this correctly in the chat. By course, do you mean these work sessions?
I wonder if it's referring to the provider journey that I've been describing, which would be on this meeting series.
Let us know if we answered that correctly in the chat for you, Laura. Or if you want to jump on for any clarification. If not, I'll jump to the next question. Will CCOs have timelines for credentialing qualifying HRSN providers? For context, I've seen a lot of variability in credentialing timelines. CVOs will need some assurance of how fast they can start delivering services versus being on the hook with a to be determined timeline for service provision.
Sorry, can you repeat that for me?
Yeah, will CCOs have timelines for credentialing qualifying HRSN providers? For context, I've seen a lot of variability in credentialing timelines. CVOs will need some assurance on how fast they can start delivering services versus being on the hook with a to be determined timeline for service provision.
Yeah, I don't think I have a great answer for that. I think there's variability between the service providers and the credentialing process. So I'm not actually sure when you use the term credentialing, the CCOs, there are qualifications that a CBO, like an organization that's providing services, will need to attest to, but there's not credentialing unless you're talking about the MMIS registration process. I just want to ensure that I'm giving accurate information. If you want to clarify what you mean by credentialing.
What I mean by that is becoming a provider who can get paid by the CCO. Usually there's a process to enter into a contractor agreement. And maybe credentialing was the wrong word to use there, but I have seen substantial variability based on provider type. And we're not hearing about that very much locally yet in my particular region, Central Oregon, from our CCO about how to get ready, how to be prepared. And with the timelines rapidly approaching, I was curious how fast they'd be able to turn around an agreement, or if OHA was requiring a specific timeline to prioritize these folks so they can get paid and deliver the services within the waiver expectations.
Yeah, I understand. So you're talking about developing a contract, and I do not think that there will be a requirement for timeliness. I think that's the intention. For them to develop a network, they are going to need to get these new contracts in place pretty quickly. So from the state's perspective, it's about developing a network, so ensuring that they have service providers in their network and that serve these members and provide these benefits. It would be very difficult to have a specified time frame for the contracting process because there's so much variability with organizations and CCOs. But appreciate the feedback, and I think that is feedback that is really helpful to continue to hear, especially as the implementation begins. So thank you. Yeah, so there's questions about the capacity building funds, and I want to just stress for you all that we have not, these are all proposed timelines, so there's a few variabilities with, what we've proposed. We are still needing approval from CMS on a couple on our, it's called the infrastructure protocol, which is the same as the capacity building funds. It's just the CMS term. And then the DSHB funds, which actually are the resources that fund the capacity building funds. So we have received, acknowledgement from CMS that they believe they're going to get that to us by the end of the year. So we are, reliant on our work with them. If all things keep moving forward as well as they are at this point, then we hope to have this grant program kick off, the capacity building funds grant program kick off in 2024. So again, we'll need to get final contracts executed with the CCOs to manage the program and get CMS approval. So if our timelines all align, we will have the program launch in 2024. The grant, the applications will be available through March and April. And then there'll be a review process by the CCOs and partners. And initial funding would be available around July or August. Actually, Suzanne or Mandy, can you confirm that it's July or August? Is it August?
Yeah, Lisa, so it would be the first chunk of funding would be able to go out in August, and then again in October, all of next year. And like Lisa said, all subject to change based on what we hear back from CMS, but that's the preliminary timeline for now.
Yeah, so we adjusted our timeline based on feedback that we received from actually this meeting series about slowing down and allowing more time for that process. So that's reflective of the new timeline. I think the next question is from Nick, and it says, would we as an individual organization make decisions on how much money a Medicaid member is eligible for, or would this be part of the training we get to understand what is allowable per member? So again, I just want to make sure that we're being really clear about what we're talking about. The community capacity building funds are for organizations to become ready and able to serve Medicaid members HRSN benefits. The benefits that HRSN members will receive are not funds, so it will not be, it'll be a benefit. So some of it may be rental assistance, but that would go to a landlord. So there are not funds being dispersed directly to Medicaid members for these services. There are services that will be provided. So for climate, that one's a bit easier to, I think, kind of understand in terms of like, those are climate devices that will be delivered to a member. Nutrition services, you know, it'll be food and nutrition related services and supports that are provided. It will not be funds. Yeah, so an organization, yeah, sorry, I'm just following up. I didn't see the last part of that. In terms of like a pool of money, and there will be a grant award available to organizations that request and are awarded, but there will not be just cash available. Yeah, so for nutrition, it would be a prepaid card with a food provider. It could be something similar to that. And we're still working on the services definitions with CMS. So a specific service for nutrition is still to be determined. The STCs, you know, provide one level of what we are authorized to provide, but we need to get much more specific in terms of being able to provide that services. And we're still working on that with CMS.
Okay, we have another clarifying question. How is the amount of the benefit for Medicaid member determined?
Yeah, so let me see if I can answer this correctly. So Medicaid benefits are defined. So what a Medicaid benefit is and what it entails will be specifically defined based on what we get approved from CMS. And then the fee for providing that service will also, is also, we will develop it and will be approved by CMS. And then in terms of which member is eligible, that is, so it's defined in our STCs, and then it is further defined based on the clinical criteria and the social need criteria that we get approved by CMS. Seems like a convoluted answer. Let me know if that's not clear.
Yeah, no, that's helpful. I was just curious about like back to that earlier question of, do we then get the training to understand, like, when we're trying to provide this, like, through rent assistance, is this something that we would individually determine and get training for, or are we just like helping connect them to, I guess, the larger system? I guess that's kind of my question there.
Yeah, and I think the provider journey is going to be very helpful for answering some of these questions, but there will be a screener and components within a screener that organizations will use to determine if someone is eligible for this benefit. And then they'll submit that screener either to a CCO if they're a CCO member, or to the TPC if they're open card or fee for service. And they will approve whether or not the service can be provided. So they'll determine, like, yes, this is our member. Yes, they meet the criteria. I definitely think training is going to be really important and a part of this process. But it's the CCO or the TPC that will verify the benefit for the member. And y'all can definitely call me on speaking Medicaid. I definitely have been in Medicaid a long time, so I'm trying not to, but I'm not always successful.
Just want to make sure that we did answer all the questions that are in the chat. And encourage everyone to ask questions. We do have Lisa, we do have a couple of other folks here that are able to go into more depth and answer your questions and provide clarification. So encourage everyone to take advantage of that and share your concerns with these provider qualifications and questions you might need to have clarification on.
Yes, Natasha, that's correct. If you are going to serve members from multiple CCOs, you would need a contract with multiple CCOs.
Another question in the chat, is there a link to show who the CCOs in the local areas are?
There is, and I wonder if I could ask someone from OHA to put that link in from our OHA website. Suzanne, could you pull the CCO link and share that? Yep. Thank you.
I just dropped the map in the chat, and then Suzanne is going to pull up the website and drop that there.
I thank you so much for that. I really appreciate it, both of you. I have not heard too many questions about 1 through 6 on the screen. If there are, love to hear some feedback about that, good or bad. Any challenges, anything maybe that you all think should be included here that is not, so a gap. Would really appreciate any feedback on that.
This is Arlette Upshaw again. Just a question going back to being reimbursed, and I saw in the chat somewhere that there was someone that mentioned a concern about some of the CBOs being small in size, and perhaps, you know, they can't afford to be waiting for to be reimbursed. So I know this might be a little premature, but is there an estimated time that it would take to get reimbursed once the invoice is submitted?
So again, I think I want to clarify. So if we're talking like rental assistance, the payment would go directly from the CCO to the landlord for that rental assistance. The CBO would provide the supports for the member around that service delivery. Does that make sense?
I think my question was more about the funds that might be reimbursed to the CBOs, if there is any.
Yeah, it's a really good question. I'm not sure that I do not think that we have a standard requirement across all service delivery domains. And if Mary Durant's on, I don't know if you can correct me or confirm that's accurate, but I don't believe that we do. I think there is a standard expectation in the CCO contracts and the TPC contracts that they are paid in a timely manner. I can certainly follow up and find the exact language though.
Yeah, Lisa, one thing that applies here is there is federal clean claim guideline, which says that 90% of clean claims need to be paid within 30 days. I think our goal, and from what I've heard from the CCOs, their goal is going to be making that as short as possible, because we do understand this is a different type of situation and we want to get the money out the door as quickly as we can. On the fee-for-service side, our intent is to have sort of a 2 to 3 week cycle from when you get your invoice to the TPC, assuming it's all clean and great, for the TPC to process it and send it to us for us to process it 1 week for the claim and the next week for the payment. So we have goals for what we want to do. I like to make promises and keep them. And right now because we have a few unknowns, but we're definitely targeting the shortest time frame possible.
And
Right.
Misha, I think, sorry, I'm not sure I interrupted there, but do you want to continue?
No, I was just wanting to say, from experience, with the state, I know there's with the MMIS, I mean, we bill MMIS for our services, and that takes anywhere from 2 to 3 weeks, and that's great. But there's been some other contracts with the state, and it takes months. And so I was just curious, but thank you.
And Misha, I saw your question. I think Mary just answered it in her response, but let me know if you have a follow-up or if it did not.
No, I mean, I understand. I'm just also sympathetic to what Lindsay has written in there. If we're trying to be trauma informed and all of these things, I mean, one of the things that's really challenging is setting up expectations that won't be met in a timely way, and promising or appearing to promise things that don't arrive in time to be helpful for people. So I'm just wondering about, it'll be very important to be clear on expectations and what is going to be possible. It's just really tricky, finding a sympathetic landlord and then asking them to wait an undetermined amount of time to receive some funding. But yeah, it's what we're up against.
Yeah, I really appreciate that feedback and definitely want to continue to hear, as we roll this out, what everyone is experiencing. I do want to just clarify the Central Oregon payment timelines. Oh, okay, sorry, I was reading this as Central City. You're saying Central Oregon, through Medicaid, you're not receiving payments for up to 120 days. Is that accurate, Lindsay?
Yeah, and
Okay.
that team is working very hard. So I just want to, my reference point is health related services, flexible services payments for individuals, of which a housing payment may be one of the interventions to keep people in housing. And so I think their ORS gives them up to 120 days to process non-urgent requests, and we absolutely see them take that long. But even with more urgent requests, from the date of approval, we're seeing up to 6 weeks to cut the check and transmit it to a landlord. And so that's, far too long.
Yeah, that's really helpful. Sorry, please go on.
Yeah. So I just really want maybe, for OHA's standpoint, to really be talking with the CCOs about what their experience is with health-related services and flexible services, and how quickly they're getting these payments out the door and their learning curve for that, because we're about to launch a program with additional and different criteria. And I would hate to see us repeat the same mistakes that we've seen with the flexible services process. And I think there's some good lessons to learn.
Yeah.
But again, just to be the most broken record on this call, really think that our community action agencies and other housing providers have dialed in how to get this money out the door really quickly. And I do not see enough collaboration between those entities for how to make sure that landlords are getting paid as soon as they need to get paid.
That's really helpful feedback. I do want to clarify that health-related services are different than HRSN services in some really important ways. Health-related social needs, sorry, I think I just misspoke and said health-related services twice. Health-related social needs are Medicaid benefits and a required benefit that a CCO must provide, versus HRS, health-related services, oh my goodness, losing it, are optional and a different process, different requirements. So there are differences. I think, you know, I don't want to say that I think there's a lot of learning to be done in how we're going to do this. So I want to definitely say that I think there's a lot of potential, and echo what Mary had said. And like we, you know, are certainly working towards our target, and there's a kind of acceptable practices within Medicaid, but I want to make sure that, you know, it's understood these do have very different requirements around them.
We have a couple of comments in the chat. One about the HRSN provider qualifications. I think the criteria makes sense, though there may be wide interpretations of what providing trauma-informed care or culturally or linguistically appropriate delivery of services may mean. I'm guessing this will be expanded on in the future, as that would be helpful if there are specific resources that could be a good example of standard of care would be nice.
Thank you. That's really helpful feedback.
And some more feedback. In contrast, when CBOs receive funds to support people during COVID with things like rent and food, we were able to cut and deliver checks within a few days, not having to go through another entity such as a CCO.
Yeah, we've definitely heard about and are, you know, really trying to pull forward lessons learned during COVID. Again, this is a Medicaid benefit, and so Medicaid requirements and processes are required. It is, you know, Oregon was one of the first states to receive this. There are now about 5 or 6 other states that have received a similar benefit. So we are going to be going through a learning process for how this works as the Medicaid benefit. A lot of learning ahead of us, I'm sure.
We continue to encourage everyone to share their feedback and ask clarifying questions on these things. What you all have been providing so far is really valuable, and we have the right folks in the room that are taking all of this with them and helping with the creation of things with this waiver demonstration. So please keep your questions and concerns coming this way. Some clarification in the chat on what trauma informed is.
Yeah, we have some definitions that we use within CCO contracts and with our Medicaid providers, and we can certainly follow up with that. But it is an approach to providing care.
or in a nutshell, I can kind of share a little bit about trauma informed. So it is an approach to be really human centered and acknowledge that an individual receiving services has probably experienced some sort of trauma. And then so when working with these systems who have potentially caused trauma, being sure to not re-traumatize an individual or add to that trauma experience. Hope that's helpful. And like Lisa said, we can send some follow-up definitions.
Sorry, I was just trying to pull it from our guidance document so that I can share the exact language. I'm just not sure I can do it fast enough. No.
Maybe an ask would be to help us be able to compare to what is currently being worked upon, is if you all could expand upon what trauma informed means to your organization, what culturally and linguistically appropriate delivery of services would look like for you all, since you all know community best and are working with different sectors of the community, and can really help us be able to figure out how this would fit with your organizations and how we can make this sector of the work and take your feedback to help us create a better system.
Totally, it's a good reminder for us and our appendix resources to make sure we define all the terms that we use, so that we can really share the same definitions that we're talking about. And thank you, Suzanne, for sharing that resource. I cannot find our latest guidance document. I want to make sure that I share the accurate definition that we're using at OHA for that.
And just as a reminder, we will be sharing this slide deck and the recording of this session to all those folks that have signed up for the session. So even if they didn't get a chance to attend, we will share it with you all. So if you share it with your colleagues, when they register, we automatically are adding you all to an ongoing listserv for the HRSN provider work sessions. So if you've registered in the past and have registered for these other meetings, then you're a part of that listserv. And you can always email us as well, so we can add you if you have other colleagues that would want to join us in these sessions. let's jump to the ending slides. If we don't have any more questions, we'll just share these are the ways that you all can stay connected with us. Just a reminder, you can email us here at the 1115 waiver renewal. And also you can check updates and more information on our website. That renewal website also has an option for Spanish. So just at the very top, you can select that if you want to see that version in Spanish. And also subscribe to our bi-weekly newsletter. So this is fairly new, it's still ongoing. So please sign up for that. That's the list specifically for that. That's where we share all of the updates for the waiver. We encourage you all, and also specifically for these sessions, the HRSN partner work sessions, we are working on dates for the new year. And so please be on the lookout for an invitation for the next session. Like Lisa mentioned, we will be focusing on provider journey and sharing more on what that will look like for you all. So please be on the lookout for that invitation. And I'll be quiet. Any last minute questions, comments, concerns? Let me check the chat. And Misha, if you're talking about the meeting tomorrow is the All Come webinar series. And those are they're different than these sessions. These sessions are specifically for those that are interested in being HRSN partners and delivering these services. The All Come is for general updates to our partners and to the public. And so tomorrow's topic for that, I believe we'll be touching upon the climate benefits updates. And so we invite you all to join us for that. That's also a great opportunity for you all to share feedback as well during the chat and during the presentation. And to register for those webinars, it is through our website as well. And I can drop the links for you all to sign up. In the chat for both the English and the Spanish webinars. The Spanish webinars are the third Wednesday of the month, and the English webinars are the first Wednesday of the month at 10 a.m. All right, if there are no more questions, thank you all so much for joining us today. Thank you for sharing your thoughts and feedback. If you want to follow up with us as well, like I mentioned, the email is a great place for you all to connect with us outside of this work session, so that you can let us know your thoughts and concerns. And we look forward to seeing you at the next work session. And more to come on the invitation, and everybody who's here will get that sent your way. And we encourage you all to share that invitation within your network, so we can get more folks doing the groundwork like you all are doing into these sessions and helping us form the waiver.